Well, I was always very active. I've been playing soccer for the last 20 years, and I actually had no idea I had just tore my ACL because it was just such a different kind of pain that I had never experienced before.
Ken was a very competitive athlete growing up. He played a lot of soccer. He injured himself. It was a pretty classic history for his injury, which was an ACL tear.
Dr. Ochoa, first time I saw him, he kind of ran some tests on me to see what was going on. The verdict came back that I had a grade 3 ACL tear, which is the worst that you can possibly get.
For people who are very competitive and like to go back to playing cutting sports and are below the age of 35, 45, we always recommend that they have their ACL reconstructed.
Well, Dr. Ochoa recommended definitely surgery if I wanted to be back to sports, competitive sports. And at the time, I kind of wanted to avoid that as much as possible, so I did my own therapy.
And he actually did it for quite a while, almost 2 years, and did go back to playing some soccer, but he did have problems with instability and recurrent swelling in the knee.
So after about maybe another 6 months of playing with a torn ACL still, I ended up hurting my knee a little bit more, and at that point I just considered surgery.
The procedure itself is done what we call arthroscopically assisted, and that means that the majority of the incisions are for the arthroscopic camera. They're 3 to 5 millimeter incisions around the patella tendon, 2 of them. And then we do have to have a smaller incision or a bigger incision to harvest the graft and create the tunnels that we put the graft through.
So the day of the surgery, I showed up in the lobby, they took me in, and next thing I know I was asleep. And I woke up and I had a brand new knee.
This happens to be one of those surgeries where physical therapy is a very important component. It's one of the nice advantages of the San Antonio Orthopedic Group is we have integrated physical therapy in most of our clinic locations, so it makes it very easy to keep close communication with the physical therapists and the patients while they're going through that, and make sure we can fine-tune their therapy to their needs.
I'm running, I'm sprinting, I'm cutting, I'm shooting. So that's, at that point, I'm only about 6 months after surgery, so I'm very happy where I'm at.
Ken is doing great. He just recently got cleared to go back to cutting sports. He was eager to get back to it.
Dr. Ochoa always supported me in my decisions. He always gave me great advice as well. And we kept in touch along the way. And when I decided to give him the green light on the surgery, I think we both agreed that that was the best decision for me. So yeah, I'm very excited to be able to get back on the field. I've waited for that moment for so long.